Excessive urination. Excessive urination, two types. One is in terms of the frequency. You call it frequency of urination. That is one child passing more than 8 urine in 24 hours is called excessive urination. At the same time, when it is passing less than 3 is called the infrequent voiding. Both are not good. Normal frequency is 4 to 8 urine in 24 hours. And another way, excessive urination is your amount. More than 4 ml per kg per hour is called your polyuria, excess urine. So, and then less than 1 ml per kg per hour is called your oliguria. That means amount. Amount is less, frequency is less. You have some diagnosis, some diseases. Amount is more, your frequency is more. You have some other diseases. So they are to be dealt with in this way. When the mother says, "My son or daughter passes excess urine," this is how you go on evaluating. If you have the oliguria and then your infrequent voiding, you have some of the disease earlier. I said earlier. So the investigations and your treatment of those diseases. Child not drinking enough water is the commonest cause of infrequent voiding. Prolonged school toilet is not good. Child hasn't gone to the toilet. In fear, he or she forgot to no, your drink water. This is also common in the school-going children. In the home, the young kids when they have some disease which is too sickness, septicemia infection, that do hinder their drinking of water, breast milk, and other liquids. So they have oliguria. At the same time, tubulopathy, renal tubular disorders, renal tubular acidosis, the Bartter, Gitelman, they do have excessive urine production because the tubule failed to retain your water. Thereby, they have excess urine output. They are to be diagnosed by the electrolyte, then sodium, potassium chloride, and bicarbonate. Where your renal tubular acidosis is diagnosed by hypokalemia, hyperchloremic metabolic acidosis. So, and the Bartter gentlemen, they are diagnosed in their fashion. Bartter has your alkalosis in spite of the acidosis. Despite not in the in case of which is the case with the RTA, and gentleman has hypomagnesemia. So this entity should be referred to the appropriate specialist, maybe a pediatric nephrologist, and dealt in appropriate way. Pollakiuria is common. The frequency, daytime frequency, point not the polyuric, not their children are not polyuric. They do it when they are awake. Psychological, they do not have enough excess urine. They have same urine repeatedly. They feel like voiding, but they do not. They only few drops in the urinate, few drops in the toilet. So this children has psychological. They forget when they are sleeping, when they travel long. They do not do this trouble. So this is psychological. Just counsel the parents that this is the what I said earlier. But nighttime and both daytime symptoms should be taken as organic disease and should be dealt with as such investigations and treatment.